Well, it's another Foxy Moms Wellness Wednesday, and if you're planning on expanding your family, listen up. Nurse practitioner with Colorado Springs Gynecology Associates, Melinda Lacey, is here with some important things you should do before you become pregnant. Good morning.
Good morning.
I'm so happy to have you here. We're talking preconception care to improve your pregnancy outcome, right?
Absolutely. We're trying to look at risk assessments as far as really decreasing before you get pregnant.
And this is really important because many pregnancies, of course, are unplanned, and that means that, women are not really taking the precautions that they should. So you actually are saying, regardless of your immediate plans, this is something you should really think about.
I think it's something that should be offered to all women of childbearing age in case they are considering pregnancy or just want to know that there's preconceptual counseling out there.
All right, you have, let's put up a graphic because you have some things that you recommend people should do, women, before they become pregnant. So this is what they should be doing now. You want to be current in all your physical exams, right?
Absolutely. We encourage to have a routine wellness exam. That way we can explore health history, family history, if there's risk factors that we can try to alleviate before pregnancy to try to help outcomes such as anemia.
The other thing is you want to achieve your ideal weight now. You're going to gain weight when you're pregnant. You don't want to diet when you're pregnant, right? You want to start off where you want to be.
Absolutely. You want to come in because you're going to gain the weight. If you're coming in heavy, 30 pounds over, you're going to have that much more to lose after the baby. Plus, it's going to be hard on your body physically as far as aches and pains.
Now, we hear a lot about exercising when you're pregnant, which is fine, but you kind of want to have that routine already in place. You don't want to start exercising, when you haven't before when you become pregnant. That's not the time to do it.
Well, especially in the first trimester, because a lot of women really feel not very well.
Right, right.
They're tired, they don't feel well, either they can't eat, they get dehydrated. So trying to put that pressure on is a little bit late.
Now, current on immunizations and dental care, why is that important? The dental care, I've heard a lot about that.
The dental care is important because there are some kinds of bacteria that can get you septic, and having advanced like gingivitis can put you at risk for some of those diseases.
Okay, and you want to be up on your immunizations for obvious reasons.
Obvious reasons, because some illnesses, when you get them in pregnancy, can cause birth defects.
And I think the obvious is, but it's definitely worth repeating, you want to, if you're thinking about getting pregnant, you want to stop smoking. You want to stop taking, not only illegal drugs, but other medications that maybe are not very good. You may take now, but when you're pregnant, it's not a good idea.
Or to review the list at your wellness exams. If you do have some kind of a chronic disease and you are on medication, there are certain medications that are safer in pregnancy to take than others.
Okay.
And so reviewing that is one of those things that we do go over at your exams.
So the bottom line is make sure you think about all these things because you may not want to, get pregnant right now. Sometimes it happens. You want to make sure you're as healthy as possible.
And we have to remember that the majority of fetal development happens within the first trimester. And a lot of women don't even come in until they're 8 weeks along to 12 weeks.
Some great advice. You're going to be on every month giving us some wonderful advice for the ladies out there. And you have a website as well, correct?
Absolutely. It's COSGA.com. That's COSGA.com. Colorado Springs Gynecology Associates.
Thanks so much, Melinda. We'll see you next time.
Thank you so much.